Okay, hello everybody. So I did my project on hospital-acquired infections. These are also known as healthcare-associated infections, or HAIs, and these are infections that patients can get resulting from medical treatment while in the hospital. So this is actually a very common problem within the medical field, and I found out that 4.5 million of these infections result in about 37,000 deaths per year. So the most common of these infections are bloodstream infections, catheter-associated UTIs, surgical site infections, and pneumonia. So overall, HAIs actually have a really big impact on the economics of it all. So annually, I found that about $28.4 to $33.8 billion are used in having to help with HAIs and keeping the patients in the hospital for longer amounts of time, which is not the best thing. But then after interventions were put into place, it decreased to $5.7 to $6.8 billion, which is still a lot, but better than before. So I chose these three QSEN competencies because I felt like they just really captured the entire issue of HAIs. So with safety, I feel like that's kind of straightforward to just prevent harm to the patients. And like since the patients are already in there for what they were admitted for, now that they have a hospital-acquired infection, they're going to have to stay longer. And so for nurses, they can just keep in mind like their aseptic techniques and like how they're cleaning things so that when they go from patient to patient, they're not carrying in extra bacteria that could cause the patients to stay in, and then that, also goes into the whole economic issue for what they have to pay and what it's costing the hospital. So safety is just kind of overall the general QSEN competency I thought of, but then also there's quality improvement. So I feel like this is also kind of straightforward, that nurses would just use their current knowledge along with new information in order to improve the quality of their care towards the patients. And then that also kind of bleeds into evidence-based practice. So, and not only nurses, like also physicians, like techs, like anybody, to just stay up to date with the new data and studies in order to integrate that into their current nursing practice as well. So HAIs, like I said, are very common infections that patients get resulting from medical treatment while at the hospital. So these infections actually appear within 48 hours up to 72 hours of admission, or within 30 days once discharged. Also with HAIs, they're mainly within the ICU setting, just because of, ICU patients are critical and a lot can happen, but HAIs are also, can also be found on other units as well. So it's not strictly ICU, but ICU is the main unit that these are found on. So you have to be extra careful. And then in one of the research articles that I found, it said that the Agency for Healthcare Research and Quality reported that HAIs are the most common complications of hospital care and are actually one of the top 10 leading causes of death in the U.S. So with the most common infections, I found to be C. diff, UTIs, and pneumonia. So UTIs are actually the most common type of hospital-acquired infection and the top microbial infection, and that's a catheter-related issue. But then pneumonia is also a really big issue, and they refer that to VAP, which is ventilator-associated pneumonia. And this actually has a really high death risk within the ICU because these patients are more, at risk to get these, and if they're on ventilators, then that, has to do with ventilator-associated pneumonia. But it's secondary to their diagnosis, and normally if patients get VAP secondary to their medical diagnosis, they are more likely to have a higher death risk due to the endotracheal intubation. So like I said, there are 4 different types: central line-associated bloodstream, surgical site, which is also known as wound infections, catheter-associated, and then ventilator-associated pneumonia. So from what you can tell, HAIs are a very important issue due to the fact that it causes patient morbidity and mortality rates to go up, but there are ways to prevent this problem. So, the significance in nursing, according to the CUSIN competencies, like I said before, I feel like they all just kind of blend together, but for safety, putting proper infection control precautions in place is very important because this will protect both healthcare workers and the patients, so it kind of works together. With evidence-based practice, like I said before, staying up to date with current infection control research will help healthcare workers be more aware of the spread and then how to prevent this. And then quality improvement, when safety measures are put into place, like said earlier, along with the evidence-based practice, the overall quality of care will be greatly improved. So all of these put together, I feel like kind of just add a holistic view to prevention. So my first article was just discussing how to manage hospital-acquired infections within the U.S., and it kind of talked about the guidelines and interventions and just measures to be taken, and then about the risks. So, as stated earlier, bloodstream infections are the most common, and then for pathogens, it's the top is bacterial, and then second is viral, and then third is fungal. So, like I said, HAIs pose the biggest threat in ICU patients, and the World Health Organization estimated that 30% causes morbidity and mortality. So when it comes to the risks and the guidelines and how to prevent these things, the researchers in this article said that some main ways to prevent HAIs from happening would be alcohol swabbing of stethoscopes when you're in the room and like about to leave to go to another patient, just making, like, you don't normally see that in the hospitals, but it's a really good way to prevent bacteria from spreading, even if it's like one extra step to do. And then air sampling in the OR and the ICU, proper use of PPE, the use of spacers and ventilators would be really important in preventing VAP. It really emphasized disinfection of like everything, including tables, like beds, files, everything. A big emphasis also on proper hand hygiene, which we all know is very important, but just, I mean, it's the top way to prevent infection. And then also for shoe covers when going in to patient rooms, but that's mainly for the ICU. So most of these bacteria that are spread to cause HAIs were found to be MDR, which is multiple drug resistant. So that's why they put a lot of emphasis on disinfection. But these antibiotics were divided into medical and surgical ways in order to prevent misuse of medication. And then I just found that the overall interventions for ICU procedures would be hand hygiene, doctors removing aprons prior to entry of patient room, and then shoe cover. So with this same article, this is a graph showing the ventilator-associated pneumonia rate from 2010 to 2017. So in this graph in particular is just showing the average of VAP, and it started in 2010, it was 11.8%, and then by 2017 it decreased to 6.6% once interventions were put into place, of course. So hospital-acquired infections in general was all the way up to 26.5% in 2010, but then throughout interventions it decreased to 8.82% in 2017. So this just kind of shows that when healthcare workers of all kinds just put in these proper interventions and ways to prevent the infection, it can go a long way. So the ventilator-associated pneumonia was mainly secondary to the original medical diagnosis. And then the researchers said that resulting from the invasion of the lower respiratory tract and lung parenchyma by microorganisms, and it is usually attributed to antibiotic-sensitive pathogens and multi-drug resistant bacteria. Okay, so my second article was a research survey done to discuss the contamination rate between healthcare workers and patients. So, like I said, ICU patients are the most at risk. And so in this study, they took 605 and 762 swab samples from ICU workers and then general healthcare workers' hands. And the most common bacteria was found to be, I'm going to try to say this right, Acinetobacter baumannii, and then staph, but yeah, was followed as second. So a big issue with these within the HAI realm is that these bacteria are all multiple drug resistant, and so it's really hard to get rid of them, and that's how they spread so easily from patient to patient, and healthcare workers don't know that they're carrying it on their hands. That's why proper hand hygiene all the time is very important. So they said that surfaces that should be regularly disinfected include bed linens, the patient beds, the nurse's station, patient tables, the phones, ventilators, call lights, patient files, honestly, it's kind of everything. So, and then they also found, I thought this was kind of interesting, that secretaries were to be in contact with these bacteria most of the time due to shaking hands and touching the phones, touching equipment, touching a lot of patient files. So I thought that was kind of interesting. So going along with this article, there were these two graphs. So the first graph shows the bacteria isolating from ICU and healthcare worker hands. So it said that nurses actually held the most. It was 426 of them. And then housekeepers, which there were 155 of them, were found to be in second place. So that kind of made sense. And then with the second graph on the right is the different environmental samplings on the items in the ICU. And again, a lot of this is within the ICU, but like I said, hospital-acquired infections can be found on any unit, but this is just in the ICU. So according to this graph, they found that patient beds had the highest percentage of bacteria, and then second were patient tables. So really anything that the patient is touching, but also the nurses touch and housekeepers, physicians maybe, so it's all spreading from person to person. And then when it comes to ventilators, they were found as third. And ventilators also, it said that, like right here, it has the most of, I just don't know how to say that, but the A. baumannii, the most common bacteria, were found on the ventilators. So that's why spacers and changing that out for every patient is really important, so that bacteria, again, isn't going from person to person and causing more people to stay in the hospital for a long period of time. So for practice, I felt like both of these articles kind of did a really good job on explaining the prevalence of hospital-acquired infections and ways to prevent. So the common themes of prevention throughout were, of course, hand hygiene, and then the frequent use of aseptic technique, which would be a lot of disinfection, as they emphasized in both of the articles. And I mean, those first two kind of go together because it's a lot of just making sure that when you're touching other things that it's not spreading all this bacteria that cause these secondary infections that also happen to be deadly, especially for ICU patients because they're in critical condition. And due to their invasive procedures, so they're all just kind of in the open, And then third was the correct antibiotic usage. And then, like I just talked about, the ventilator spacer use and just making sure that things get changed out and nothing is reused like that, and so everything is clean for every patient that uses it. Education and research priorities. So how to educate staff about hospital-acquired infections. So just like those two graphs show, the nurses and healthcare workers just might be unaware of the bacteria and germs that they are carrying on their hands or even on their scrubs and equipment, and then they're passing it on from patient to patient. So I just kind of thought, regularly seeking evidence-based practice is really important so that they're staying up to date with the current statistics and just, data in general, like what's going on. And by regularly staying up to date with it, all the current stuff is coming through so that they are up to date with what's going on. And then just for nurses and, healthcare workers in general, not just nurses, but having the knowledge of the common bacteria that are found. Because when I was looking at all of these, there were some that I recognized, but there were some that I didn't at all. And how are you going to know what bacteria you're carrying on your hands? And so just having the knowledge of the common ones that are out there and like what they can do and just how to prevent them, and then still using proper disinfectant and like knowing which ones are multiple drug resistant so that you can have the right tools to keep everything clean and sterile. So my case example, and like I was saying before, not every patient, not every unit will have hospital-acquired infections, but again, it's just different from patient to patient and the care that they're given. So this is a patient that I had in my preceptorship, and I was on a med-surg unit, so that's not the ICU. So I felt like this was a good one to use since it wasn't in the ICU, and so that y'all can see that it's in different units. So my patient that I had was a 68-year-old male, and originally, before he came to St. Mary's, which was where my preceptorship was, he was originally admitted to Athens Piedmont Regional for a COPD exacerbation. And while he was there, he acquired pneumonia while he was at the hospital, and that was secondary to the COPD issue. And it wasn't clear, I didn't have that information on how he got it, I just know that he did get it. So they discharged him with steroids and PO antibiotics, and then within, I think it was like 4 to 5 days, so still within the 30-day limit, after discharge, he was then admitted to St. Mary's. And he ended up, so we were treating him for pneumonia, and then he ended up testing positive for flu, so he had a lot going on. And they had him on vancomycin and then Marum, which is another strong antibiotic. And so while he was at St. Mary's, he also developed severe shortness of breath, a wet productive cough with green sputum, and then hypoxia. So after he was tested positive for flu, we also gave him Tamiflu, and then he had a CT of the chest, which showed the pneumonia in the left lower lung field. And then he was also given an incentive spirometer. And after being at St. Mary's for a couple of days, things were looking up for him, and he was healing. And I think the day that I was there, he was about to get discharged within, 2 days to 5. So he was in the hospital for a long time, including both of those two hospitals. So not everyone who gets a hospital-acquired infection will die. It just is according to how critical their condition is and the care that they're given. So in conclusion, hospital-acquired infections are the most common, and they are more dangerous than one might think. I had never really thought of this issue before doing this project, so now I feel like I'm more aware, and hopefully y'all will be too. So like I talked about earlier, HAIs impose a large economic impact, and so it's really important to have the proper precautions and interventions put into place in order to prevent these from happening, and also to prevent, like, it improves the quality of the patient's life by not having to stay in the hospital for that long. And even if they get a hospital-acquired infection, they're still in the hospital and with all that other bacteria anyway. So I mean, it's just not the best for the patient. And we're wanting to provide the best care as nurses. So then, common findings was that the most causative bacteria is the, we're just going to say A. bomini, and then the most common types are UTIs, C. diff, and pneumonia. Pneumonia as in being very severe. And then to prevent, like I have said multiple times, to emphasize proper and frequent hand hygiene, literally all the time. Full PPE, especially in the ICU settings, strong disinfectants of all surfaces. Even if you don't really think about it, you should probably still clean it. And then keeping up to date with HAI evidence-based practice, and just making sure that you have everything clean and that you're providing the best care possible to your patient. So that is it.